how do you get to a premium price for your medical practice? Well, there's several different ways that you can do it. One is it depends on your location. So where you offer your medical services, depending on where they are location-wise and what they're related to, can change the way that you can charge for their price. So for example, if you are doing a treatment for anybody who has back pain, that is a very generic audience, right? But if you're doing a treatment for golfers who have a hitch in their back and it affects their swing, that's a much closer niche. So because the location of your service is at a different place than where everybody else is saying, hey, I'll treat your back pain. And you're saying, hey, I'm going to treat your back pain as it relates to your golf swing so you can get a better golf swing. Now you have a different product and it's worth a higher premium. The other thing that you can do is you can change your packaging. And this is something that we don't do very well in medicine, right? In medicine, so often people come in, especially for, insurance-based or mainstream medicine, you have offices that are very bland. They're somewhat sterile appearing. Many times the patients are referred to by number, not by name. It's somewhat of a dehumanizing environment. I know, for example, when COVID happened, so many patients left the mainstream medical system because they got tired of being treated poorly by practitioners. If they didn't have the exact same viewpoints as the practitioner, many of them were banned from services. Many of them were not allowed to come in. They were told, different things. And so the packaging around your service is so, so important. How do you treat somebody when they come into your practice? What does your practice look like? When you offer someone a medical treatment, for example, a procedure, do they come home with anything? Is there a care package that they have? Recently, we were doing a procedure just today, and one of the things that we do for all of our patients who receive this procedure is when they go to leave, we have a box that they take with them. And in the box is instructions. It has some equipment that they can use to help them improve their performance after the procedure and these kind of things. This is different packaging than they would get anywhere else. If they were to go to, say, a mainstream medicine doctor to get the same treatment, they wouldn't get any of that. They would be seen in probably 15 minutes or less because that's what you have to do to make those numbers work, and their quality of procedure would be less. Their quality of time with the staff, the quality of time with the physician would be so much less as well. The next thing we want to talk about is niche. So often in medicine, we think all of our procedures, all of our therapies apply to everybody who could possibly have them. And while that may be the case for some procedures, you can also argue that you can niche these down. So for example, if you treat someone with knee pain, what is the difference between treating everybody who has knee pain and people that are mountain bikers with knee pain? You see, the mountain biker likely has a different type of knee pain from mountain biking, assumably. And so you can offer a different type of service for that person. If you're treating, as an example before with location, you can treat golfers, right? So if you treat golfers versus everybody else, because you have a niche, whenever you niche down a service or product, you're able to charge more for it because the value of it is higher. I'll give you an example that we can use for all of us here. Imagine I have a time management course, and it's a time management course for everybody. Now, if I say, hey, here's a time management course, it's worth $20. Now I say, take the same time management course, and I say, oh, it's time management course for doctors. Well, because it's designed for doctors, and we know doctors have perhaps a busier schedule, they have other things that they're dealing with, then that's a higher value or higher perceived value of that product because it is actually for a niche. Now, if I take the same thing, I say, okay, I have a time management course for anesthesiologists, which are a subset of doctors, right? Now, that's even a smaller niche. And because it's for anesthesiologists, there might be some modifications we make to it that kind of take into account the anesthesiology lifestyle. And that would even have an even higher premium because it is more niche down. So any service that you offer to the market, I'd like for you to think about how can you niche it down? How can you take your service and make it more niche for a small audience? And finally, number 4, one of the best things you can do for increasing price and getting the pathway to premium prices is to make something exclusive. Only offer so many of them. And a lot of times people in medicine think, oh, it's so difficult because, I offer service. Anybody can walk in and get it. Any patient can come in. I want to treat everybody. The reality is that there's only so much time in the day. There's only so many resources you have. There's only so much OR time you have. There's only so much room you have in your clinic. Is there a way that you can make an exclusive experience for just a few people? Is there a way that you can take one of your services, Let's say let's take an example. Like for example, let's do something that's so bland and generic, right? So you could have somebody doing a trigger point injection, common procedure done by family practice, pain management, you name it, orthopedic, everybody does this, right? They inject a muscle with a needle, put a little, maybe an anesthetic and perhaps even a steroid in it, depending on what you're doing. And it helps relax that muscle, right? So that is a generic service, and its value is essentially set by the government, which is Medicare. And that value is fairly low. I think it's under $20 now. So depending on how many points you inject. Now, could you make that more exclusive? Could you do a treatment where you did a trigger point injection along with a Tibetan healing bowl treatment? Now, maybe for most people, they're not familiar with Tibetan healing bowls, but for some people, they really believe strongly in them. And I'll tell you that, it's at least an interesting and unique experience. So is it possible you could take one of your services and add a little exclusivity and say, hey, I'm only going to allow 3 people to get the service. Here's what we're going to do. We're going to take you to a room. It's going to be dark. We're going to give you a massage. We're going to inject all your trigger points. We're going to do Tibetan healing bowl. We're going to do some cupping. And then basically now we have a whole new service, and the thing is only good for 3 people. But the price is much higher because it's exclusive. Do you see how you can add anything? Like the only thing limiting you to premium pricing really is your creativity.